Joining us now from Advanced Wellness is Dr. Pathare, and we're going to be talking about body sculpting and also a very interesting protocol, not often used in the United States, that helps with alcohol addiction. Welcome to the show. How are you?
Hey, how are you?
Good.
Thanks for having me here. It's a pleasure to be here.
I'm very excited to meet you because I know that you help a lot of people.
Thank you.
You're triple board certified. So what does that mean?
So I'm board certified in 3 specialties:
Okay.
physical medicine and rehabilitation, pain management, and addiction medicine.
Okay. What came first?
Physical medicine and rehabilitation.
Okay. What made you decide to become a physician?
When I was young, I always loved science, and I also had an incident when my father had a severe asthma attack and had to be rushed to the emergency room. And when that happened, not many people were willing to help him. And I was maybe 10 years old, and I had to literally walk with him to the emergency room. Some passerby gave us a lift, and by going to the emergency room, we saved his life.
Wow.
And I saw the power of medicine right there.
That was it. You were hooked.
I was hooked.
Yeah,
Yes.
because you didn't want to see your dad suffer or anybody else suffer.
Correct.
I always
Yeah.
wonder about that. You know, a lot of times, especially when the physicians really go into it with the right purpose of being other-centered, as opposed to just like, oh, I'm going to be a doctor or a lawyer because I can make a lot of money. But when you really choose it as your profession because you really care about others, it seems to me like you're always the better physician. You're always better for it, right? You know, you want to go to someone that really cares about you, cares about your journey. And I guess that's why you decided to do the other boards, become board certified in other things as well.
Yes. So I became board certified in pain management because I was treating a lot of patients with pain. Some of the methods I was using were limited. And so to do interventional pain management, you have to do a fellowship, extra training, which I did. I became the chief of pain management at Richmond University Medical Center, and I've been the chief there for the last maybe 20 years. And then recently, about 4 years ago, I wanted to become board certified in addiction medicine with the purpose of helping people primarily with alcohol use disorder.
What is, you're the first person that I've heard describe it with those words, okay? Alcohol abuse disorder.
Alcohol use disorder.
Use disorder, okay.
Yes.
So what is that in your terms?
So alcohol use disorder is the new term that was given for alcoholism.
Okay.
There's a set of criteria that have to be met, but it's a very big problem in the United States. So in the United States, 15 million patients suffer with alcohol use disorder, and only 8% of them get treatment. That 15 million number is big because that's more than 5 times greater than the opioid epidemic.
Really?
Yes.
And just as deadly sometimes.
Just as deadly. So, if not more deadly. So there's 95,000 deaths every year from alcohol use disorder. It doesn't get as much media coverage, but it's a bigger problem by more than 5-fold.
I think a lot of times it's because those that aren't afflicted or don't know someone that is, they tend to think, well, then just don't drink. You know what I'm saying? They blame the person, right? And be like, well, just don't do it. And not everybody can just go cold turkey. What are some of the steps in your protocol that you have seen some success with? What are you doing?
Right. So what you mentioned is very interesting. So the main treatments in the United States are 12-step programs like Alcoholics Anonymous and inpatient rehabilitation centers. So inpatient rehabilitation centers are where you go for 1 to 2 weeks. They try to get you off of alcohol, and then you're supposed to stop drinking afterwards. And both programs focus on what you just said, abstinence. Abstinence is telling someone who's been drinking a lot and drinking heavily to stop drinking and to continue stop drinking, but it's very difficult to do. It's very difficult to do. So my protocol is a modified comprehensive protocol based on various studies that work, but these methods are not really being used in the United States. So, for example, there are studies in Europe which show 80% success rate with people drinking a lot less and even obtaining complete abstinence. But 95% or more physicians in the United States don't use these techniques. Some of the medicines that are used in those European studies are available in the United States, but they're not being prescribed and not being used in the same way as they were in the European studies. So they're not as effective.
But you've been researching it, you've been learning about
Yes.
it, and you've been putting it to play.
Yes.
Lovely.
Yes.
That's really wonderful. And a lot of times, one of the things, which came first, obesity or alcoholism, right? Do people sometimes drink because they're uncomfortable with the way they look, or are they not, do they not look as good to themselves because of the alcohol, right? It's which
Right.
comes first. But you also help people with body sculpting, which I thought was interesting, right? And that's more for their own, like, I guess, self-esteem in most
Yes.
cases.
Yes.
Okay, how does that work at your practice?
So the body sculpting is, I wanted to make people aware of some relatively new technology that's out there. So there's technology that's out there that I even wasn't aware of, and I'm a physician. So the technology is TrueSculpt Flex and TrueSculpt ID, which is the best ones on the market in my opinion. And what they do is they can eliminate permanently fat and build muscle without the need for surgery or medications or injections. And the results are pretty amazing.
Now, is that like with vibration or sonic pulses, or like, what does
Yes.
it do?
Yes. So the TrueSculpt Flex is one technology that will build 30% of muscle mass and muscle thickness with the 15-minute treatment. The 15-minute treatments are spread out over 2 weeks, and it's a series of 4 treatments. And what that uses is a technology called a multi-directional stimulation technology. And what that does is it continuously stimulates the targeted muscle area at an intensity and duration that you just couldn't achieve with regular exercise. So for example, if a healthy adult could perform 100 sit-ups, one 15-minute treatment with the TrueSculpt Flex, that patient can perform the equivalent of 54,000 sit-ups.
Interesting.
And the same thing with the squats. They can perform 54,000 squats with a 15-minute treatment.
Oh my goodness.
Yeah.
It's a lazy person's dream come true, right?
Right.
Right. You can go to the gym, just go to the doc. Also, what I find interesting is because in pain management, sometimes they use stimulation,
Yes.
right? And so you probably are kind of melding all of your knowledge for the greater good.
Right. So the stimulation that's being used for this is at a much different frequency and intensity. And when you mention pain management, it's interesting because when, it's hard to lose abdominal fat, right? But losing abdominal fat and building up your core muscles is very important in preventing back injuries and with chronic back pain. So it plays a role. And building up muscles in your legs is also very important for strength training and also avoiding injuries. So if you try to do 100 or 200 squats, you could injure your knees. I mean, I used to do squats every single day for years, and I used perfect form. And I ended up getting a medial meniscal tear in my left knee. So now I can't do squats anymore. And then the same thing with sit-ups. If you have back or neck issues, or even if you don't, you could injure your back or neck trying to do hundreds of crunches or sit-ups.
Interesting.
Yeah.
So I love the fact that you're on top of all the technology. Thank you for being here. And also thank you for all the families that you're helping, because alcoholism doesn't just, or as you called it, alcohol use disorder, doesn't just affect the one being. It affects, their whole family and also the entire community.
Yes.
So very, very much, I thank you.
Thank you.
Stay tuned for more. This is Donna Drake, and we've been living it up right here. We've been living wellness, and I hope that you are as well.